Acute sore throat poses a significant burden on primary care. It's also a source of inappropriate antibiotic prescribing. Corticosteroids could be an alternative symptomatic treatment. Anna Cui reports from EBC Bureau in Las Vegas.
Having a sore throat, though not a serious condition, can really be uncomfortable. But is taking antibiotics a necessary treatment? Recent studies in the Journal of the American Medical Association finds an alternative. Patients in the United States made 92 million visits to the doctors for sore throats between 1997 and 2010. Many of those patients received unnecessary antibiotics.
The more antibiotics that we take, the more likely we are to develop infections which are resistant to antibiotics in the future. So it's important to try and find alternative treatments. We wanted to know if steroids could be an alternative treatment for sore throat.
Dr. Gail Hayward of the University of Oxford and her colleagues studied almost 600 adults with sore throats who didn't require immediate antibiotics from clinics in England as part of a randomized trial. Half the patients took a 10 milligram dose of the corticosteroid dexamethasone, while the other half received a placebo. The researchers then measured whether sore throat symptoms were completely resolved after 1 or 2 days.
After 24 hours, we didn't see any difference in the proportion of patients who felt better between those taking the steroid and those taking the placebo. However, at 48 hours, we did see a difference. More patients in the group that took the steroid tablet felt completely better than patients in the placebo group.
Although more patients who took the steroid felt completely better after 48 hours, Dr. Hayward says there are many downsides to taking steroids, including difficulty sleeping, acid reflux, and increased appetite.
Although steroids are probably not ideal to be used in primary care for all patients presenting with sore throat, what our study couldn't really do is look at those patients with very severe sore throat. We think that it's possible that in very severe sore throat, steroids might help patients to be able to swallow fluids and medication and avoid needing to go to hospital, which could be very beneficial. This research has not yet been done.
For Eagle News, I'm Anna Cui, and I am 1 with 25.